Hi, my name is Dr. Fred Mutamba. I'm a member of Mt.Olives SDA Church, and I greet you in the loving name of our Lord Jesus Christ. Today I want to share with you a few details about the second wave of COVID-19 in Uganda. It's back with us, real, more than it was last time, and unfortunately with sad stories. Currently, our statistics stand at about 40,700 people, cases of COVID-19, and we have the death number about 334 by the current statistics of our Ministry of Health website. What's new about this current wave that we have? Uniquely, it is affecting the young people, as young as the teens, 12 years of age, 15 years of age. So those are people who are in school, university, the workforce, people who are in different places of works. They are all being affected by the virus. And unfortunately, with categories like pregnant mothers, we're having mothers who are having the virus and they have to go into labor, and unfortunately some of them have even severe disease. That makes even the quality of care and the standard of care for such mothers very complicated, and that's why it is a very bad wave. Have the symptoms changed? Not so much. We still have the same symptoms: cough, sore throat, high fevers, body pains, general body weakness, and so on. Has the course of the disease changed? No. The biggest percentage of people get simple symptoms as a simple flu and they get well. A small percentage of people get very sick and they require hospitalization. Some of them will need oxygen, others will not need oxygen. Those who need oxygen, some of them will end up in the need for ICU. As we speak now, our current ICUs are getting full. I know of hospitals where you can't be admitted now because the capacity for non-ICU beds is full. ICU full, such that if you walk into that hospital and you need hospitalization, all they can tell you, try somewhere else. That is the sorry state that we are in with this current wave of the pandemic that we are running now. The same factors that predispose you to hospitalization haven't changed. If you have chronic illnesses, if you are quite old in age, and if you have any other underlying illnesses like cancers, diabetes, hypertension, your chances of getting to a state of requiring hospitalization are high. What to do? Same story. I'm going to have a colleague of mine share with you what you need to do to guard ourselves against the current wave that we are undergoing. Thank you.
So what happens if you get diagnosed with COVID-19? You should not worry. A lot of the people that get COVID-19, 98% of them will not get the severe form of the disease, and therefore home-based care is available. With home-based care, it means you're able to isolate at home and take your medicines and treatment at home. The key thing about managing COVID-19 is with relieving the symptoms. Therefore, you need to take a lot of fluids, you need to take rest, eat a lot of fruits, a lot of vegetables, and boost your immunity to be able to fight the COVID-19 pandemic. What is in the package for home-based care? You need to take vitamin C, zinc, azithromycin, and paracetamol for where you get a fever. While at home, you're encouraged to isolate in a room alone. If you can use a separate bathroom, use a separate bathroom. Make sure you're keeping your room open and aerated. And what you need to look out for is, when does my condition start to deteriorate? And when do you need to call for help? So if you discover trouble breathing, you start having challenges with breathing, you turn, if your lips turn blue and black, then you need to be able to rush out and get support from the hospital. We need to continue to stay vigilant. We need to keep the standard operating procedures, and therefore we recommend that you wear a mask 100% when you're out of the home, and when you're in a crowd. You need to keep safe and social distance. You need to keep washing your hands with water and soap. And where you can use a sanitizer, continue to use a sanitizer. Let's not keep the guard down. Let's continue being very, very vigilant. If you can avoid crowded places, please go ahead and avoid crowded places and keep safe. At the back of your mind, make sure that you're keeping yourself safe, but you're also protecting your family from getting COVID-19. Together, we can walk through this second wave, and with God on our side, we should be able to come out alive. Thank you very much, and God bless you.